ஒரு குட்டி லேக் இருக்கும்ல. இது Dear to students, welcome to Renal Function Test Part 1, Hematuria. And there are so many tests with respect to renal to assess the renal function. But today we are going to concentrate only on hematuria. Okay, what do you mean by that? The red colored urine. That is what the patient is going to say. That is what the mother is going to bring the child. Right. But do you think that all red colored urine are due to hematuria? Are due to presence of RBCs in urine? No, it is not. Because before going to renal function test or urine routine to find out urine for RBC, just ask whether the child has been on any drugs which can impart urine red color. What are all those drugs? Can you tell me anyone? What are all the drugs? Rifampicin. Very good. So the drugs are one, rifampicin. Then nitrofurantoin. Nitrofurantoin. What else? Phenolphthalein. Phenolphthalein. These are all the drugs which can impart red color to the urine. Can you tell me any food product that can impart red color to urine? Yes, a well-known fact. Beetroot. So let me write in red color then. Beetroot. Can you tell me any metabolites that can cause red colored urine? Any metabolites? Yes, two metabolites. One is porphyrin. The second one is tyrosine metabolites. So these are all the things has to be ruled out before going to investigate a case for urine for RBC. Right. Then next. So the first thing is something which imparts red color urine, drugs, foods, metabolites. The second thing is red pigments in urine. What are all red pigments in urine? Very, very simple. There are only two pigments that can impart red color urine. One is myoglobin and another is hemoglobin. I am not talking about RBCs. When RBCs are broken down, hemolysis, when it occurs, hemoglobin will be released. Presence of RBC in urine is different. Presence of hemoglobin in urine is different. How to differentiate between these two things? Let me clear. Wait. So hemoglobin, these two are red pigments in urine. Right. Now, let us come to hematuria. What do you mean by hematuria? Hematuria means, true hematuria means presence of RBCs in urine. How many RBCs should be there in a high power field to say that the child is having hematuria? Yes, Keshav? More than 5 RBCs. More than 5 RBCs per high power field. More than 5 RBCs. Okay, but it is not visible to the naked eye means, it is not visible to the naked eye means it is called microscopic hematuria. Microscopic hematuria means you can see only in smear microscopy, whereas when it is visible in the naked eye, it is called gross hematuria. It is called gross hematuria. So microscopic hematuria can be visible only in microscope, whereas gross hematuria is visible to the naked eye. But anyhow, you need to have more than 5 RBCs per high power field. What do you mean by significant hematuria? It means more than 50 RBCs. More than 50 RBCs per high power field is called as significant hematuria. Then what is called persistent hematuria? Persistent hematuria means in more than 2 occasions during a period of 4 hours, if hematuria continue to occur, then it is called persistent hematuria. That means you need to document 2 or more times of RBCs in urine during a period of 4 weeks. If the interval between 2 episodes of hematuria is more than 4 weeks, then it is called recurrent hematuria. The causes are different. Right. Then, so as I told you, it can be a recurrent or it can be non-recurrent. Persistent means, what did I tell you? Persistent means what? 2 or more occasions of RBCs. That is how much? 5 per high power field within 4 weeks. If the gap is more than 4 weeks, then it is called recurrent hematuria. Gross hematuria means visible to the naked eye. Microscopic hematuria means can be visible only in microscopy. What do you mean by symptomatic and asymptomatic? Asymptomatic means only when you examine urine, you will find RBCs. It can be an incidental detection. That means the patient will not be telling any symptoms. You suspect something, you do urine routine, in that urine RBCs will be plenty. That is called asymptomatic hematuria. But if the child is having symptoms with respect to renal, means for example renal colic, it occurs in renal stones, or it can be due to extrarenal manifestations. So when you have symptoms either renal or extrarenal, then it is called as symptomatic hematuria. Right. Why this picture is depicted to you? Very simple. The one marked with this red box is called as glomerular hematuria. What is that? Because it contains glomerulus, epithelium and endothelium. And when it is beyond glomerulus, I repeat, when it is beyond glomerulus, it can arise from pelvis, it can arise from tubules, it can arise from urinary bladder, it can arise from ureter, or it can arise from urethra. So what does it mean? You have something called glomerular hematuria and non-glomerular hematuria. Why it has to be given that kind of significance? Let me tell you why you need to give that kind of significance. Because glomerular hematuria will be associated with renal failure, some dysfunction with respect to renal excretion, whereas non-glomerular hematuria that arises from pelvis, tubules, ureter, urethra will not be associated with the rise in urea or creatinine. Is it possible to differentiate clinically by looking into the urine? Is it possible to say this child has glomerular hematuria and this child has non-glomerular hematuria? It is very simple, my dear friends. Look at this. So what do you mean by upper urinary tract and lower urinary tract? So hematuria can arise from upper urinary tract and lower urinary tract. Upper urinary tract indicates glomerulus, convoluted tubules, collecting duct and interstitium. That is the glomerular tuft, the Bowman capsule. That is called upper urinary tract. Whereas your pelvic calyceal system, ureter, urinary bladder, urethra means lower urinary tract. But to me, you need to divide only two things, glomerular or non-glomerular. Yes, this is glomerulus. This is glomerulus. Your upper urinary tract glomerulus contains also includes convoluted tubule, collecting tract, interstitium. Lower includes these things. Look at this photo. Can you tell me which is glomerular and which is non-glomerular? 𝐂𝐄𝐝, the one on what is this? And what is this? What is the color of this urine? Tell me, what is the color of this urine? Cola colored urine. So this is called cola colored urine. Cola colored urine, and this is bright red urine. This is bright red urine. What do you mean by that? Cola colored urine means the RBCs are broken down. Where these RBCs are broken down? Glomerulus. So cola colored urine means glomerular pathology. Glomerular pathology. Whereas bright red urine means RBCs are intact. That's why you will get bright red color. So it is non-glomerular pathology. It is non-glomerular pathology. Point number 1. Point number 2. Look at this. The urine examination on the left and urine examination on the right. What is this? What is this? The one on the right and one on the left. So look at this. The RBCs are disformed. The RBCs are having some kind of blebs. This bleb, RBCs with blebs, otherwise known as dysmorphic RBCs. Dysmorphic RBCs means the RBCs while traveling through the diseased glomeruli gets deformed. So dysmorphic RBCs means glomerular pathology. Glomerular pathology. Look at this. The one on the right. What is this? Cast. What is this cast called as? RBC cast. RBC cast. So if RBC cast means the tubules are intact. The tubules are intact. RBC cast means the RBCs are normal. So while traveling through the tubules, it forms a cast. So what does it indicate? Presence of RBC cast, again non-glomerular pathology. Non-glomerular pathology. Right. Okay. So what are all the points? Glomerular pathology means cola colored urine, dysmorphic RBCs. Non-glomerular pathology means RBC cast, bright red urine. Any other thing apart from this? Apart from this, any other thing apart from this? Yes, presence of proteins. When you have proteinuria, then it is called as what? Glomerular pathology. When you don't have proteinuria, then it is called non-glomerular pathology. So 3 points, my dear friends. Cola colored urine, dysmorphic RBCs, nephrotic range of proteinuria means glomerular pathology. Bright red urine, RBC cast, and then non-nephrotic range of mild proteinuria indicates tubular pathology. Very, very important for your examination. Right now, so it was told to my friends already that it can be due to red pigments, it can be due to red colored products, or it can be due to hematuria. As it was told you already, is it possible to delineate the causes? The answer is yes. Even without asking the history, yes. What do you need to do? When you have confusion, sometimes what will happen? Sometimes what will happen? One second, some annoying call. Right. So sometimes what will happen? the parents will not be aware of what drug they had given, what vegetables, foods they had given. So, in that sense, what you need to do? In that sense, what you need to do? Very, very simple. Take 10 ml of urine, my dear friends. Take 10 ml of urine and centrifuge the urine. And centrifuge the urine for 10 minutes. 2500 rotations per minute. Just give that urine sample collected by the parents, give it to your biochemistry department. They will spin the urine and give it to you. And what you will have, look at this, my dear friends. So this is normal urine. But look at the right. The sediment is red in color. The supernatant is clear. So what does it mean? In that first photo, you have red sediment. In that second photo, you have red supernatant fluid. So either you can have red what is that? Red sediment. So red sediment. Red sediment means this one. If you have red sediment, the answer is clear. It is a case of hematuria. It is a case of hematuria. When you have a red supernatant, so this is true RBC. This is true RBC. But look here. Red color supernatant fluid. So what is this, my dear friends? Red supernatant fluid. Not sediment. Red supernatant fluid. What does it mean? When you have red supernatant fluid, that is one which is formed above. Supernatant means then you need to look for urine heme. You need to look for urine heme. Okay, how do you check for urine heme? Simple, my dear friends. Urine heme can be done by a dipstick method. It can be positive or it can be negative. If it is negative, the answer is it is neither RBC nor heme. Then what you need to do? Very, very simple. It can be heme or myoglobin, both. Then what you need to do? Very, very simple. So it is neither RBC nor pigment means something else. So negative means something else. What something else as we discussed already? What something else as we discussed already? Very, very simple. One, it can be drugs. It can be pigments. It can be food. Now comes, it is pigment. What you are going to do? You need to confirm whether it is myoglobin or hemoglobin. Now what you need to do? Look for plasma color. If the plasma color is red or plasma color is clear. If plasma color is red, the answer is it is hemoglobin. The RBCs are broken down. Hemolytic, G6PD, intravascular hemolysis. If plasma color is clear, then it is myoglobin. Myoglobin. That's it. Is it easy or tough? Okay, so is it easy or tough? Very, very easy. So take urine, spin it for about 10 minutes, 10 ml of urine. If sediment is red, hematuria is confirmed. If supernatant is red, do dipstick method. If dipstick is positive, negative. Negative means food, drug, pigments. Positive means look for plasma color. Plasma color clear, myoglobin. Plasma color red means hemoglobin. That's it. Very, very simple. Okay. Right. Very, very simple. So glomerular, non-glomerular hematuria. One more time. Cola colored urine. So what is that? Cola colored urine. Here red colored urine. Here urine nephrotic or nephritic range of proteinuria. In lower it is less. Here RBC cast dysmorphic RBCs. Okay. Here normal RBCs. Okay. Right. Then what are all the causes for asymptomatic hematuria? So what does it mean? Asymptomatic hematuria means what? The child is fine, but routine examination revealed hematuria. What are all those things? So one is Alport. Second one is thin basement membrane disease. Thin basement membrane disease. I am sorry, I can't write Alport. I am sorry. So one is thin basement membrane disease. What do you mean by thin basement membrane disease? Normal basement membrane is 400 nanometer. But in thin basement membrane, it is less than 150 nanometer. That is called thin basement membrane disease. Usually, there is no need to give any treatment for this condition. Second one is idiopathic hypercalciuria. Idiopathic hypercalciuria. Calciuria. When will you say idiopathic hypercalciuria? So idiopathic hypercalciuria means urine calcium by urine creatinine more than how much, Keshav? More than 0.2. Urine calcium by urine creatinine more than 0.2. So these two are main causes for asymptomatic hematuria. Now look at this. Causes for symptomatic hematuria. If it is associated with dysuria, it can be due to cystitis, inflammation of the urinary bladder. Or if it is associated with severe pain, it can be due to renal stones. Systemic symptoms, renal systemic symptoms. Let me tell you, the child is having palpable purpura, hematuria with palpable purpura. The child is having arthritis. The child is having abdominal pain. Can you tell me the diagnosis? HSP. What is that? Enoch-Schonlein purpura. So this is Enoch-Schonlein purpura. Whereas when it is associated with some other color, when it is associated with mental retardation, ash leaf macules. Yes, what is the answer? Sjogren patch. What is it, my dear? Sjogren patch. Tuberous sclerosis. Tuberous sclerosis. Because in tuberous sclerosis, which is a neurocutaneous syndrome, it is associated with renal angiomyolipoma. Angiomyolipoma. That is associated with grass hemorrhage. That is nothing but a hematomatous malformation. Now, what are all the causes for recurrent hematuria? Very, very, very important. 1. Alport syndrome. Alport syndrome. 2. Thin basement membrane disease. 3. Idiopathic hypercalciuria. Calciuria. 4. Idiopathic hypercalciuria. What else? IgA nephropathy. IgA nephropathy. These are all the causes for recurrent hematuria. Right. Then some of the important clinical case scenarios. When you have pain with hematuria, the answer is very good. Renal stones. When you have hematuria with dysuria, it is due to cystitis. When you have hematuria that occurs 2 weeks after pharyngitis, post-streptococcal glomerulonephritis. But one more patient is telling you, I have hematuria as well as I have throat pain. Doctor, yesterday I developed throat pain, but today I am getting hematuria. What is this? This is called synpharyngitic nephritis. That is, in the post-streptococcal glomerulonephritis, your hematuria occurs 2 weeks after pharyngitis. But here, hematuria occurs within 2 days of pharyngitis. This is called, what is that? Keshav, right? It is called synpharyngitic nephritis. Syn means together. What is the answer? IgA nephropathy. The answer is IgA nephropathy. Finally, when hematuria is associated with deafness, Alport. Alport. So today, the topic of hematuria, part 1 is over. Bye-bye. Meet you next Wednesday. Again, the topic is renal function test. Bye-bye.